Hello, everyone. How are you doing today? Trust you are doing well. I'm also good. This morning in our food and nutrition class, we're looking at a very interesting topic that has to do with our health, and that is the topic reproductive health. What do I call the topic? Good, reproductive health. It has to do with our health. So at the end of the class, I will expect that you should be able to tell me what reproductive health is all about. Then you should be able to tell me the common reproductive health issues relating to the male reproductive health and the female reproductive health, then the environmental impact on reproductive health. What impact does the environment have on our health? And then we should be able to look at key preventive health measures. What are the measures we can take or to prevent this environmental impact, then we should be able to apply the knowledge we have acquired from this class to maintain a reproductive wellness. Now, what is reproductive health? Talking about reproductive health, it refers to the condition of male and female reproductive system during all stages of life. When I say all stages of life, we're talking about from the toddler, that's the infant stage, to the teenage, adolescent stage, the adult stage, and the last stage, which is the aged or elderly stage. So, what does reproductive health condition, or what is your reproductive health condition during all these stages? Now, understanding reproductive system. We need to understand the reproductive system of both the female and the male. For the female reproductive system, we have the pituitary, which controls the hormone production. Then we have ovaries that produce eggs and hormones, and then we have a uterus that supports fetal development. That's the fetus in the womb of in the ovaries. So when you talk about the pituitary, you talk about the ovaries and the uterus. We're talking about the female reproductive system. Now, talking about the male reproductive system, we also have the pituitary that controls the or regulates the male hormones. We have the testicles that produce sperm and testosterone, and we have the hormone that maintains reproductive health. So when we talk about testicles and when we talk about sperm, we talk about testosterone. We are talking about male reproductive system. So those are the features of the male and female reproductive system. Now we know the features of the two reproductive systems. So what are the common female reproductive system? What are some of the disorders that female encounter in their reproductive health? The first one is endometriosis. That's a uterine tissue that grows outside the womb. Uterine tissue growing outside the womb. We call it endometriosis. Then we have PCOS. That's PCOS is it means polycystic ovary syndrome. Polycystic ovary syndrome. That's when the ovary produce excess male hormone. This is a common hormonal condition that affects women of reproductive health, and this PCOS can affect a lot of things in the female reproductive health system. One of the things that this PCOS can cause is irregular menstrual cycle, and then it can also affect a female conceiving and giving birth to children. Now, another condition that can affect women is menstrual disorder, irregular or heavy periods. When there's menstrual disorder in the female reproductive system, can affect their reproductive health. That's why you find out that some women they are having issues with conceiving, that is getting pregnant. It's because of some of these issues mentioned here. Then we have uterine fibroid. We have a lot of cases of fibroid for women. Fibroid is a non-cancerous growth in the womb of a woman. So when you have this fibroid growing in the womb, then there's a tendency and every possibility that that woman will be having issues conceiving and giving birth to children. Then the last one is fertility issue. That's difficulty conceiving naturally. Some women find it difficult to conceive naturally because of their fertility issues. So these are the common disorders that affect the female reproductive health. Now let's look at the common issues that affect the male reproductive health. We have testicular cancer and inflammation risk. When there's testicular cancer and there's inflammation risk For the male, it affects their reproductive health. Then we have enlarged prostate that affects urinary function. When there's an enlarged prostate, it affects their urine system. Then we have another one which is very common, which is that's low sperm counts. It affects fertility considerably. Then we have if the testosterone level is low, it affects the male reproductive health. So we can see those things that can affect the male reproductive health here. Now, regular screening can prevent major issues. So if you go to the hospital regularly to check on yourself, medical checkup, regular screening, it can prevent these major issues. Now, there's something we call BPA. BPA stands for bisphenol A. All right. Bisphenol A is an industrial chemical that has been used to make certain plastic and resins since the 1950s. So this BPA exposure mainly comes from packaged food and plastic containers. It can affect breast milk production and infant development. To reduce exposure, use BPA-free containers. We have a lot of plastics that are that we use this chemical to produce. So if you keep using this plastic for children or breastfeeding lactating mothers, then you are exposing them to BPA, which can affect their reproductive health. So we should minimize the use of BPA containers or canned food and avoid thermal receipts. You can use glass or stainless steels; those ones are better alternative for food storage. Then we have some other environmental impacts or chemical exposure. All right. But how can we prevent this environmental impacts and chemical exposure? We can choose a BPA-free product, like I said. Then we can avoid plastic containers when, if possible. Then we should read product labels carefully before we buy or purchase it. Read your product label very well and find out that it's BPA-free product you are buying, so that you'll not be exposed to those chemicals from the containers or plastics. Then, for chemical exposure, these are some of the risks. We have phthalates found in plastic if affect hormones. We are still talking about environmental impacts or chemical exposure. When we are exposed to chemical or some impact on the environment, it affects our reproductive health. So we have this phthalates that is found in plastics and it affects hormones. Then chemical exposure impacts fetal growth and it's increased risk of developmental issues. So the fetal, that's the fetus in the womb, will find it difficult to grow very well to affect its development in the womb. Then what will happen to the fetal development in the womb? There will be low birth weight risk. The child will be giving birth to was very, very small. Early puberty onset possibility. That means the female or male child will start puberty quite very early. Then developmental issue may delay a lot of changes in the body. Developmental issue may delay may occur in a lot of situations in the body system. Now, what are the preventive measures? What are the things we need to do so that we can prevent this chemical exposure and environmental impact? The first thing we need to do is schedule a regular reproductive health checkups. Always see your doctor. Go to the hospital and check up yourself and see how you are doing health-wise in terms of reproduction. Then maintain adequate vitamin D level. Take a lot of food that contains vitamin D and then follow a balanced, nutrient rich diet. Take a lot of vitamins, minerals, proteins, carbohydrates, and water. It will help your reproductive health. Then, in terms of the lifestyle and our environment, what do? We avoid exposing ourselves to harmful chemicals, just like we talk about the BPA. As much as possible, check labels and find out that the package or the container you're buying does not have a BPA or is a BPA free container. Then exercise regularly for hormonal balance. Do regular exercise. You can do it in the morning or choose to dance to a music during the day. Just make sure that you are exercising your body regularly and then maintain healthy body weight. Don't eat too much and become obese or don't be too skinny. Ensure you have a healthy body weight so that you can have a good reproductive health. All right. We have come to the end of the topic that says reproductive health. Now for our review question, let's check and see if we have been following. I talked about BPA, okay, and I say it affects the body system, the reproductive health. So what are the chemicals that the body can expose to affect that affects the body? Okay, we have BPA, phthalates, and phenols. Good. They affect the reproductive health. Then there's some common disorders too. There's some common disorders. I told you about PCOS for the women. Okay. And we talk about endometriosis, that's growth outside the womb, that are major concern for reproduction. All right. I hope you have learned a lot in today's class. Thank you so much for attending. I will be expecting your questions if you have any, or you want to learn more about the topic. It's about your health. So if you want to learn more about the topic, don't hesitate to reach out to me. Your reproductive health matters a lot. Thank you so much and enjoy the rest of the day. Bye. Thank you so